Hi, my name is Jeanette Rosenberg-Line, and this is my SOAP note on my patient for the week. So, my patient is a 32-year-old female. She presents to the clinic alone today, and her chief complaint is my feet have been swollen for a week. So, she's a 32-year-old African American female with a chief complaint of bilateral swollen feet. She states that she first noticed it about a week ago, and the swelling is in both feet. It's constant and it has not gone down for a week. She does not notice anything that makes it worse, but when she elevates her feet, there is very little difference in the size of her feet. This is the first time that anything like this has happened, and she denies any pain, warmth, or redness in her feet. It does not interfere with her walking. She has a past medical history of hypertension, plantar fasciitis, and obesity. In 2015, she had a C-section, and currently she takes lisinopril 40 milligrams daily. Her review of systems is mostly unremarkable, except for the swollen feet for 1 week, difficulty breathing while lying flat at night. She denies any chest pain, any palpitations, or any shortness of breath, signs of varicose veins or blood clots. At night, she does say that she snores. She lives with her daughter, who reports sometimes that she wakes her up with snoring. And there is some shortness of breath at night. There is no cough. There is no hemoptysis, no frequent upper respiratory infections, or pain during breathing. Patient has no history of smoking. She has some back pain, some neck pain from a car accident that she had in 2016, and there's some generalized body aches. Today, her vital signs are blood pressure of 166/82, pulse of 106, respiratory rate of 20, temperature is 97.8, oxygen saturations are 97% on room air, pain is a 0 out of 10. She is 5 feet 6 inches. She weighs 266 pounds, which gives her a BMI of 42.9%. So on her physical exam, she is an obese woman. She's alert and oriented. She's well groomed. She does not appear to be in any distress today. Her cardiac assessment, S1 and S2 is auscultated. There is tachycardia noticed. There are no murmurs. Extremities are warm and well perfused with no cyanosis and no pallor. She does have 1+ pitting edema in her lower extremities bilaterally up to the calves. For her respiratory assessment, there is no increased work of breathing. Chest wall movement is symmetric, even rise and fall of the chest. Lung sounds are clear to auscultation bilaterally. There are no wheezings, no rales, and no rhonchi. The rest of her physical exam was pretty unremarkable. GI abdomen is distended and obese, soft, no tenderness, no guarding, no hepatosplenomegaly. Differential diagnosis for her today was congestive heart failure, hypertension, venous insufficiency, and liver failure due to the mainly because of the swelling in her lower extremities. And we do know she has a history of hypertension. We came up with the final diagnosis of heart failure, and that was based on her plan. So the labs that we did were CBC to rule out any anemias, which there was none. her complete metabolic panel to um, check her liver function, renal function, and all her electrolytes, and that was all normal. TSH, which we're still waiting for it to come back, her lipid panel showed a total cholesterol of 271. Her A1C was 5.7, which puts her in the prediabetes category. And house, we did an EKG, which showed tachycardia and left ventricular hypertrophy. Her BNP came back and it was 656, which kind of points towards the congestive heart failure. And her chest x-ray was clear except for some cardiomegaly. So today we're going to add nifedipine, 60 milligrams daily. We're going to refer her to cardiology for further workup for the congestive heart failure and to do a 2D echo. We're going to educate her on lifestyle changes to include dietary changes, weight loss, and increase in her physical activity. She was given a blood pressure monitor where she's to record her blood pressures twice a day, and then she will follow up monthly with her blood pressure logs.